From the News Channel 5 Network, this is Medical Mondays.
Good evening, everyone. Welcome to Medical Monday. I'm Carrie Sharp. Glad to be with you tonight. Our topic tonight is a tough one, but one that needs to be talked about. We're talking about Alzheimer's awareness. We're talking about the disease and treatment and prevention. Any questions you might have, go ahead and give us a call. We're going to try and get them answered tonight. As always, we try to take as many calls as we can get in over the next hour. I have a wonderful neurologist joining me tonight, Dr. Lucy Ledbetter. Thank you for being here so very much tonight. We appreciate it.
Thank you for having me, Carrie. It's good to be here.
You've been on Medical Monday before. I'm hoping that we'll get lots of calls tonight, lots of questions that we can answer for folks. You treat all disorders of the brain and all injuries that happen with the brain, but tonight we want to talk about Alzheimer's, and I know this is a big part of your practice there in Columbia. More and more people are being diagnosed right now. What are the odds of diagnosis at this point?
Well, for people over 65, somewhere between 6 and 10% have Alzheimer's disease, and when it gets to age 85, it's higher than that. It's more like about between 11 and 14%. So it's very common, and there's a number of risk factors and a number of ways to help lower your risk as well.
And as we see this baby boomer generation age, those numbers are just going to go up. We know that as a fact.
Yes, that's true. And because women live longer, unfortunately, women have a higher risk of having Alzheimer's disease as well.
If you have a question about Alzheimer's disease tonight, whether it's about diagnosis, prevention, treatment, drugs that a loved one may be taking, go ahead and give us a call right now. 615-737-PLUS is the number to call. I'll give it to you again, and we'll get it up on the screen. 615-737-PLUS. As soon as we get those lined up, we will take them. But in the meantime, I'll be the one asking the questions until we can get yours tonight. Let's just start with the very basics, Dr. Ledbetter. What is Alzheimer's disease?
Alzheimer's disease is a type of dementia that is progressive and is incurable. Unfortunately, it gradually starts with short-term memory loss, and as the brain deteriorates, it leads to change in behavior, change in abilities to socialize, and lessened ability to perform your daily activities and perform your job, and it eventually, over 3 to 10 years, can lead to death.
So that is the lifespan of once someone is being diagnosed, or really it presents itself in a person, 3 to 10 years.
That's about right, yes.
Now, obviously, we all know when it comes to Alzheimer's, it means forgetfulness, and so when people have this around them, they hear about it, maybe they have someone in the family who's been diagnosed, and they're like, I can't remember where I put my keys, where was my cell phone? And you immediately think, do I have it? How do you know when forgetfulness is really a key to Alzheimer's, when you're really moving in that direction?
Well, Carrie, that's a great question. There's a big difference between forgetfulness and dementia, and Alzheimer's disease is one type of dementia. It's the most common type. About 2/3 of the cases of dementia are Alzheimer's disease, but there can be other causes as well. But forgetfulness is normal for everybody. In fact, the most common cause of forgetfulness is you're just doing too much. You've got too many things in the air. But dementia is something very different. Dementia means that you forget on a regular basis. Typically it starts with short-term memory loss, but it involves other things as well. It involves trouble managing your finances. It involves changes in behavior, inability to adapt to new situations. It can involve anxiety and depression, and eventually it prevents you from having normal relationships with your family and friends, and prevents you from performing your job. And typically there's a long prodromal period. In other words, it takes a little while for it to develop, but then when it does, it's fairly unmistakable because people really just cannot manage their lives.
I can speak from my own family's journey with dealing with two different people in our family with Alzheimer's, my grandfather and now my stepfather. I've noticed that the people closest often are the last to say there's a problem, and it's the people 2 or 3 times removed from the person in question. They'll say, I think something's going on with granddad, or I think something's going on with stepfather. And with Alzheimer's, I do know it's so early, it's so important to get diagnosed early, right?
That's right, Carrie. It's important to get diagnosed early because, first of all, you want to rule out other causes that are potentially treatable. There are some causes that you can identify early that are actually reversible and can be treated, and you can prevent further deterioration. But also, there are some medications that will help increase the chemicals in the brain that are responsible for memory and help preserve your memory as long as possible and keep a patient able to function as long as they possibly can.
So ideally, when people would come to your office, what would be noticed? Why would somebody bring a loved one in, whether it be a father or, you know, bringing a daughter bringing a father in or a spouse bringing their husband or wife in? How would you like them to present? At what point?
Well, I would like them to come and see me as soon as they realize that there's a problem. I think in general, families know what's normal and what's not normal. Everybody forgets their keys. Everybody forgets details. But when you start forgetting daily or on a regular basis, or when you forget things that you really should know, forgetting names of family, for instance, or things that really don't make sense as far as simple forgetfulness, that's a very important warning sign that something more serious may be going on and that it's time to get help.
So what do you look for medically? How do you diagnose someone?
Well, medically speaking, when I first see a patient, I take a good history because there's a lot of clues in the history that might be important. For instance, ever having a serious head injury can increase risk. Having a history of depression can increase your risk. There's a whole list of things. But apart from that, I'm particularly looking at that first visit for things that might be reversible. For instance, has the patient developed this rather quickly over the last month or so? Have there been falls? Could there be, for instance, hematomas or subdural hematomas in the brain that might actually be masquerading as dementia? Sometimes pure depression mimics dementia, and that's something that is very treatable. So on the first visit, I'm really looking for things that I can reverse, and a typical series of tests that I might do would be a memory test in the office that gives me an idea of what degree of memory problems and what degree of impairment that person has, and then I'll typically do an imaging study like an MRI, and I'll draw some blood looking for metabolic problems like vitamin B12 deficiency or thyroid disease that might also be mimicking Alzheimer's disease.
When you look at the brain of someone with Alzheimer's, what are the key factors?
Well, on an MRI, what I'm looking for specifically with Alzheimer's disease is a shrinkage of the area of the brain known as the hippocampus. There's one on each side, and those are the areas responsible for memory. Now, I may not see that very early, but I will eventually see it on MRI if it's a diagnosis of Alzheimer's disease. But also importantly, I'm looking to rule out other things, such as a condition called normal pressure hydrocephalus, which is a type of dementia that involves a buildup of pressure on the brain. That's something that's potentially reversible, and like I said, also brain bleeds, strokes, things like that I could either reverse or maybe halt in their tracks.
Okay, we're going to take a quick break. I want to remind you our phone lines are open. We do have one caller waiting ever so patiently. We'll get to you right after the break. The number is 615-737-PLUS. So go ahead and give us a call during the break if you have a question about Alzheimer's disease, and we'll get it answered after this.
My poetry is about viewing the world as I saw it as a young man, and down to the ages I continued to write verse. I used that as a creative expression, but it also helped me through life because I could address certain issues, certain feelings, and certain appreciations. I'm a retired school psychologist, and helping people was my thing. After my stroke, when Meals on Wheels started, I was on the other end of the stick, so to speak. And suddenly I realized I was there where those other people were. Biggs, creative writer, poet, photographer. America, let's do lunch.
1 in 6 seniors faces the threat of hunger, and millions more live in isolation. Drop off a hot meal and say a quick hello. Volunteer by donating your lunch break at americaletsdolunch.org.
We wake up each and every day and watch in awe at how we've grown, all we've accomplished, and what our community can do. We are all part of a transformation, sparkling with energy and spirit. Not every day is smooth sailing, and there's always hard work to be done. But we have so much for which to be grateful. We celebrate life's moments, large and small. We've invited everyone to share what makes our home special, welcoming, beautiful. We realize in the day-to-day stories of our city, it's not always easy to appreciate the big picture. These big pictures are brought to you on News Channel 5 Sky 5. Look for a fresh perspective each new day.
It took me a long time to be able to say Chandler has cancer, because that is such a scary word. St. Jude takes care of absolutely everything. And knowing that we don't have to pay for all of the medical expenses, that's huge.
St. Jude allowed me to focus on being a mom to Bryce. And sometimes I'm just in awe of the impact St. Jude has, not only on this community, but the world.
San Jude nos ha dado todo. Nos está dando la salud de nuestra princesa. Y sin pagar nada.
St. Jude is uniquely positioned to advance the cures of pediatric cancer, I think better than any other institution in the world.
Donors are important to us because you get the feeling that you have a team behind you. We have the resources and we have the focus, and so if St. Jude doesn't do it, who will?
Welcome back to Medical Monday. Thank you for joining us. I have Dr. Lucy Ledbetter from Advanced Neurology and Sleep in Columbia joining me tonight. Thank you for being here.
My pleasure.
We are talking about Alzheimer's awareness and prevention and taking your calls as always. 615-737+ is the number to call. And we're going to get right to it. We have Cindy on the line. Cindy, thank you for being with us tonight. What's your question?
Hello, and I am a patient of Dr. Lucy's. Although I don't have this problem right now, but I was just wondering if a baseline MRI would be helpful to diagnose, just in case in the future that I may come down with Alzheimer's. And I'll hang up and listen to your answer.
Okay. Thank you, Cindy, for calling in. Great question, because a lot of folks are thinking, especially if they've seen a family member with Alzheimer's, what should I do?
Cindy, I'm really glad to hear your voice. I know exactly who you are, and thank you so much for calling. Cindy, I hope it's okay to say I think you're concerned because you have a family history of some trouble with memory in your family, and in your particular case and knowing your history, I think that it probably would be a good thought to go ahead and get a baseline MRI. That does bring up a good point, that having a family history is one of the risk factors for memory loss and dementia later on, and so that's a very good point, and I do agree that that would be a good idea for you. So,
all right, thank you, Cindy, for calling. We also have Dorothy on the line. Dorothy, thank you for calling in.
Thank you.
Go ahead with your question. Make sure you turn down that TV so you can hear what's happening in your phone.
Okay. What it is I wanted to ask her, I heard there was a difference between Alzheimer's and dementia. Dementia, you have plaques, and in Alzheimer's, your brain decreases in size until it don't function anymore.
Well, let's talk to Dr. Ledbetter about that. And I think that is a common question a lot of people have. What is the difference between dementia and Alzheimer's? Because sometimes they're used interchangeably, and that's not the case.
well, Dorothy, that's a really good question. Dementia means memory loss plus loss of some other abilities for any cause. It's a large category. that encompasses a lot of different causes, and about 2/3 of the time that the cause for dementia is due to Alzheimer's disease. In other words, the most common cause of dementia is Alzheimer's disease, and Alzheimer's disease is a progressive form of dementia that can't be cured but can be treated, and you're correct, it does gradually cause shriveling and shrinkage of the brain, and over time a person loses their short-term memory and then gradually their speech and their long-term memory and really most of their neurologic abilities, and it's eventually fatal over about 3 to 10 years.
Okay, thank you, Dorothy, for calling in. Let's talk to Sue. Hi, Sue. What's your question tonight?
Hi. I've been treated over time for pituitary adenoma. I've had MRIs. And by the way, if the doctor could speak about anything that she knows about the latest findings about gladiolinium. And my question, though, about dementia is I'm supposed to have another one of these MRIs for the pituitary adenoma. I have a history. My mother passed away from dementia. And by the way, it's not on her death certificate, and I suspect that's the case of a lot of people, which means that the funding, if it were listed, I think would be a lot greater. But in any event, my question is, if I have the MRI, could I ask that I don't know how that works. In other words, the X-ray that they would be normally doing, if that would detect the area of the brain that would be where, if I have undiagnosed dementia, if they could see that and say, in 10 years or something you're going to get it, or the likelihood is you're going to get it, or if they prefer to have, or if it's something where they would have to scan a different area, or exactly how would that work? I'm trying to see if I can't basically kill two birds with one stone.
Sure.
If that makes any sense.
Sue, that's a very good question, and you do have a complicated history. I'm going to answer the first question, and that is gadolinium. Gadolinium is the dye that's used when a radiologist performs an MRI scan, and it helps abnormalities show up better in the brain. You have a history of an adenoma, and sometimes adenomas are very tiny, and sometimes they're very large. And if the radiologists are performing MRIs on you in order to watch the size of your adenoma, it's fairly important to use gadolinium so that the radiologist will be able to see it and be able to tell if there's change between MRIs. But to answer your question, I don't know if you asked this, but I'll just answer it. Gadolinium can over time cause, or it's associated with, I don't know if it's a cause, some shrinkage and atrophy in areas of the brain called the basal ganglia, and so we don't take gadolinium lightly when we give it to patients. If I can avoid it in certain situations, I try to. If I don't absolutely need gadolinium, I don't order it. But to answer your other question, what we would be looking for on MRI for Alzheimer's disease, since you have a family member that has dementia or has Alzheimer's dementia, that would increase your risk for dementia, and they would be looking at the areas of the brain called the hippocampus. You've got one on either side, and it's associated with memory. I think what you're wondering about is how can you predict your risk based on the fact that you have a family history. One thing you might do in addition to that is get tested genetically, because you can test for the gene for Alzheimer's disease, and even though you have the gene, it doesn't necessarily mean that you will get Alzheimer's disease. It means you're at higher risk. There are several genes that can increase the risk of Alzheimer's disease, and it's important to know, especially with a family history, whether or not you carry one of those genes. There are also a lot of different things that you can do to protect yourself and decrease your risk as well, and we may go into those in just a minute. But to answer your question, when the radiologist does your MRI, you can point out that you're at risk for Alzheimer's disease, and you want them to particularly look at the size and shape of your hippocampus and whether or not there's been any change. So,
thank you, Sue. I think that's a great answer. Let's move on to Shayna. Shayna, thank you for calling in.
Yes, thank you for taking the call. My husband had an MRI a couple weeks ago, and then they followed up with a blood test, but we haven't heard the results on that. I just wondered if you can give me an insight. About 3 or 4 years ago, I noticed that there was times when he just flat did not understand what it was, and then it would come clear that, yes, this is what the situation is, and it's been going on, not getting any worse, but still continuing to a point. And also his brother and sister both had cancer, and they both had Alzheimer's, so it's a little confusing to me.
Well, your doctor is your husband's doctor is trying to find out what the cause of the memory problems are, and as we talked about a little bit ago, there could be some findings on the MRI that would indicate a treatable cause for his memory problems, and I hope that that's what they find. And also, when the doctor checks lab work, again, they're looking for things they could potentially treat and get better. With a family history of dementia, like you mentioned in his 2 siblings, it does raise his risk for dementia and Alzheimer's disease, and it'll be important to sit down with the doctor and get those results and see, first of all, is there a treatable cause, and if not, is this indeed Alzheimer's disease? Because there are some medications that can improve your husband's memory if in fact that this is Alzheimer's disease, and also whether or not there's other family members, perhaps you have children that might be at risk as well, and what they might be able to do about it. So.
Okay, thank you very much. Do you think the cancer had anything to do with it, the treatment for those other 2 family members?
Well, it depends on what that treatment was. If, for instance, there was radiation therapy to the brain, definitely that can cause the brain not to function as well, and can cause, it could potentially cause dementia. It just depends on what the cancers were, whether or not it spread to the brain, and whether or not the treatment involved radiation to the brain. And also, there are some conditions where just a cancer in the body somewhere can lead to dementia, but that's very, very rare.
All right, thank you so much.
Thank you, Shana. I do want to talk about some of the questions that have popped up and kind of been woven into a lot of these questions our callers have. The causes, let's start there, of Alzheimer's. You've talked about the hereditary factor. What else is there?
Well, we don't exactly know the cause of Alzheimer's disease, but we know that what we see over and over again in the brains of people with Alzheimer's disease are waste products that have built up in the brain. For instance, there's a substance called amyloid that's a byproduct of cell metabolism that for some reason in the brains of people with Alzheimer's disease have built up and surrounded the cells of the brain so that they don't function well. There's another substance called neurofibrillary tangles that are just, we don't exactly know how they get there, but they clog the function and the communication and the metabolism and the repair systems of the brain cells, so that the brain just gradually doesn't function well and the cells eventually die. So we know that's what causes it, but we don't know what really causes those things to happen. We know that there are genes that people can carry that tend to lead to those things, but we don't know the specific reason why those genes will activate in some people and don't activate in other people.
And isn't there some research now starting to link cardiovascular disease and diabetes with Alzheimer's?
Absolutely, Carrie. Some of the most important risk factors for Alzheimer's disease are diabetes. Some people have even called Alzheimer's disease the diabetes of the brain, because sugar is one of the things that tends to feed Alzheimer's disease. Sugar is elevated blood sugar, obesity, sleep disorders like sleep apnea that are also related to obesity, high blood pressure, high cholesterol. All of those put a person at high risk for Alzheimer's disease as well. And so there's a strong correlation between those things. And if, for instance, if a person carries the late onset gene, it's called the ApoE4 gene, then controlling blood pressure is one of the most important things they can do, along with a healthy diet and healthy weight, to prevent Alzheimer's disease.
So all the advice we've heard about taking care of our bodies also includes what's happening up here.
Oh, very, very much so. very much so.
What's good for the heart is good for the brain.
What's good for the heart is good for the brain.
Okay, we're going to talk about more on that and more of your questions when we come back. If you have a question about Alzheimer's disease awareness, diagnosis, prevention, treatment, go ahead and give us a call, 615-737-PLUS. We're coming back after this.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
A milky sky with some stubborn cloud cover for most of us across Middle Tennessee and Kentucky during the afternoon hours of Monday. This helped to suppress temperatures somewhat, but all in all, it's still a pretty nice start to our work week. Some sunshine filtering through in the evening hours will likely set us up for a very pretty sunset tonight, and we expect quiet weather to be the theme, not just into the start of your work week, but through the middle and end of it as well. Above average temperatures will also be the theme. This is what it looks like across the southeast and, of course, current conditions right here in Nashville. Overnight tonight, we drop down to 62. That is above normal. Normal this time of year is 54. And then Tuesday's highs will remain above normal. We'll hover in the low 80s for most of this work week. 83, the lucky number through Thursday. There is a weak cold front that will work towards us this weekend. The tricky part is it's expected to fall apart. So we'll have some increase in cloud cover and the chance for a stray shower, but not a widespread soaking rain.
You've got an hour for lunch. Make it count. O'Charlie's Free Pie Wednesday. A free slice with any entree. Now enjoy our fresh baked cherry pie all year long.
I have insurance.
Every Wednesday at O'Charlie's.
Next, Pickler and Ben. A random act of kindness is inspiring Kelly and Ben to be nice like Nick.
Here's $100. Let's make it $200.
$600.
Let's just round it up to $7.
Thank you so much. Can we pay for your 10-year-old's birthday?
Then, an officer, a firefighter, and their blazing barbecue sauce to the rescue.
Amazing.
Plus,
it's a really hot trend right now.
HGTV's Listed Sisters reveal picture-perfect secrets to staging your home.
Tomorrow morning at 9 on News Channel 5.
I'm liking this whole date night thing.
O'Charlie's Prime Rib Lovers Weekend for 2. Half a pound of slow-roasted hand-carved prime rib and a side with a shared appetizer. Just $13.99 per person. Only at O'Charlie's.
Welcome back to Medical Monday. We are talking about the tough topic of Alzheimer's disease, but I believe so important to talk about because more and more and more people are being diagnosed, and it's a disease that needs talked about. So we have the research and the funding and hopefully one day a cure. Dr. Lucy Ledbetter is our doctor here tonight, on call, so to speak, and neurologist at Advanced Neurology and Sleep in Columbia. Taking your calls as always, and we have Rosemarie on the line. Hi, Rosemarie.
Hi. I've got kind of a couple of little questions, and one is, okay, when I was living in Florida, and I was doing a health, putting together a health seminar, and I did some research on, diseases, and one was Alzheimer's, and about 12 years ago, Tennessee was number 3 in the nation for Alzheimer's, and now it is number 1 in the nation, and it's been in the newspapers out here. And when I moved here in 2010, I had heard that on the radio, and they were reading it from the newspaper, and I went, wow. And one of the things that I learned when I was a kid that my parents taught us never to eat anything or drink anything that came from like aluminum cans, cooking in aluminum pans and stuff like that, because that would kind of contribute to the Alzheimer's and stuff. And I've met more people since 2010, since I've been in Tennessee, that have Alzheimer's, and we're in just these few years than I have through all my entire life, and I'm going, wow. And then with the, when you say it's genetic, is it possibly because of what people are eating and what they're not eating?
We were talking about this during break, Rosemarie, so I'm glad you brought this up. We'll get back to the aluminum, but let's start with the diet, because we were talking about this, the Mediterranean diet, which I'm going to say is probably not all too popular in this part of the world, for the most part.
That's true. The Mediterranean diet is the traditional diet eaten by people who live along the Mediterranean, people who are Greek, Italian, Spanish, Portuguese, and it's it's the healthiest diet really on earth. People that live along the Mediterranean have the longest lifespans and the healthiest compositions of anybody in the world, and they have a very low incidence of dementia. Basically, the Mediterranean diet involves very little red meat, eating very little red meat, eating very little dairy, and the dairy that is consumed is typically Greek yogurt, which is low in fat and high in protein, olive oil instead of butter.
Lots of fish.
Lots of fish, ocean fish, poultry, but healthy poultry and not farm-raised poultry. And fresh vegetables, fresh fruit. They have a lifestyle that involves socializing, eating slowly, exercise. They walk typically. They relax over meals, and it's just a whole lifestyle that leads to a healthier way of life and a healthy brain. Also, maybe a glass of wine, and if you're thinking that you don't drink alcohol, a glass of grape juice once a day. It's a good antioxidant, and it helps. Antioxidants are good for your brain because they're part of the process of developing Alzheimer's disease is an inflammatory period that tends to destroy the brain, and it helps prevent that.
And you're talking about inflammation within the body. We're not talking you sprain your wrist and you have a swelled up wrist.
That's correct. Yeah, inflammation within the body, but also inflammation within the brain. And so it helps slow or prevent that stage. And also it keeps a person typically at a normal weight. It prevents diabetes. It prevents high blood pressure and all of those things that tend to lead to Alzheimer's disease and dementia.
Rosemary also mentioned aluminum, and a lot of people think about their deodorant or the pans they're cooking in. What do you know about that?
Well, aluminum was investigated probably 20 or so years ago, 25 years ago, because it was noticed that people who were on dialysis tended to have a higher rate of dementia, a higher rate of vascular dementia and Alzheimer's disease. More than likely, however, that was due to other causes. I wouldn't go out of my way to be exposed to aluminum. I got rid of all of my aluminum pans way back. But as far as I know, there's no conclusive proof that there's an association between Alzheimer's disease and aluminum. Now, there is an association with smoking. Cigarette smoking increases your risk of Alzheimer's disease by about 80%. High blood pressure, diabetes, eating sugar is pro-inflammatory, and it's a special occasion food and not an everyday food. As far as the Mediterranean diet, fruit is the dessert, not sugary desserts, and so that way the Mediterranean diet is good for you in a lot of different ways.
Okay, good word of advice there. Let's hop to Jane now. Jane, thank you for calling in. What's your question tonight?
I have read newspaper articles recently about one of the countries saying they have a cure for Alzheimer's by some type of radiation, I believe.
Have you heard anything about that?
There have been some recent studies that claim it's not with radiation as far as I know. It was with extreme healthy lifestyle and extreme healthy diet. Will help slow the progression of Alzheimer's disease. There was one report that it was cured, but I'm very skeptical about that. I know that it did not, the report that I know about did not have to do with radiation. It had to do with just an extremely healthy lifestyle. Now, the one thing I didn't mention was exercise. 20 minutes of exercise every day cuts your risk of Alzheimer's disease in half, and I'll mention that as well.
And we don't have to go out and run a mile, but you need to be moving to get that blood moving.
Walking 20 minutes a day will decrease your risk of Alzheimer's disease by 50%.
And simply because, why? Why does that help?
Well, it probably helps because exercise is also associated with lower weight, lower blood pressure, lower cholesterol, and probably some other things that we don't know about. I know exercise increases your level of dopamine, and it may increase your level of other good neurotransmitters as well.
And also, you should exercise your brain.
I'm glad you said that. Exercising your brain is excellent to help prevent Alzheimer's disease. There's the online or the app puzzles that I like are Lumosity, and it's good to practice if you don't have a computer. Even crossword puzzles or Sudoku are very, very good to help preserve your brain function.
And I know a big part of this is staying active and in a community and just, reaching out.
That's right, Carrie. Having a social type community, people around you that care about you and support you. And if you don't have close family members, reach out to people. Go to a senior citizen center, a church, temple, whatever, to help keep people around you, because it's not good to be alone. It has a higher risk of dementia.
Let's talk about the different types of Alzheimer's, because under that dementia umbrella is Alzheimer's, and then there are different types.
That's correct, Carrie. Under the Alzheimer's umbrella, the big two divisions are early onset and late onset. There are 3 genetic forms of early onset dementia that typically present themselves before about age 60. One of them that's actually very surprising to people is Down syndrome. Trisomy 21, or having 3 number 21 chromosomes, oftentimes leads to Alzheimer's dementia in patients who have Down syndrome, because it has 3 copies of a certain gene that leads to increased plaques and tangles in the brain. The other type is late onset, which is what most people have. It's fairly rare to have early onset, but most of the time when we think of Alzheimer's disease, we're talking about late onset Alzheimer's dementia, which typically presents itself after about age 65.
Okay, and we've talked about the signs and symptoms, and we'll go back and do that again, but I do want to get to Donna on the line. Donna, what's your question tonight?
My question tonight is, what does she feel about Alzheimer's versus music as like a type of exercise for the brain?
And pretty therapeutic, yeah, and therapeutic too.
Yes, ma'am. Yes, ma'am.
Music therapy, whether you're listening to good music that makes you happy or performing music especially, both of those are very good for the brain. They're good exercise for the brain, but also it's a good way to keep yourself happy, and it's a good way to improve your memory and thinking and help treat or prevent dementia.
And I've seen different studies and stories about this too, that even when someone's been diagnosed with Alzheimer's and really far along in that journey, music can really bring up memories, help them take a step back in time, and bring comfort to them as well.
That's right, Carrie. Music is a wonderful medium for any patient that has a neurologic condition, but especially Alzheimer's disease.
Let's talk about people who have been diagnosed and their families too. Once you have that diagnosis, then where does your focus need to be? What happens next?
Well, once the diagnosis is made and once we've ruled out other causes, I typically start medication that increases acetylcholine. That's the primary neurotransmitter that helps memory. And in addition to that, I'll monitor memory. I'll do memory testing in the office about every 3 months or so. And then also, we talked earlier about support for caregivers. It's hard to be a caregiver, and it's hard to take on the role of, if it's your spouse, for instance, of both you and your spouse. And so I'm very sensitive to that fact, and I always look for ways to help support caregivers. But over time, I watch to see how quickly or how slowly memory declines, and if it looks like memory is declining faster than I would expect, I add additional medications. And I always recommend the Mediterranean diet for patients. I recommend exercise as well as possible, and that's probably the typical therapeutic course of action that I recommend.
How do you temper, I'm sure, the desire that comes with all families that say, okay, well, how can we reverse this? And there's really not a lot of options, right?
There's really not a lot of options. There are medications to treat behavioral problems, to treat depression, to treat anxiety. Safety is an important factor, and a lot of times you can reverse some of the behavioral problems. You can reverse the depression that can go along with it, and it's more a matter of treating symptoms at that point in order to reverse the symptoms rather than reversing the disease itself.
Gotcha.
Unfortunately.
Yeah, that is a big unfortunate part of this disease. We're going to take another quick break. More of your calls and questions when we come back. Stay with us.
If your home is unusually dusty and you have black lines around the edge of your carpets, then your home needs Mr. B's air duct cleaning.
We have been tested before, and we know as far as the airborne particulates in a home that we remove the actual 53% of the dust out of a home.
And you can trust Mr. B's. Their technique of air duct cleaning is Middle Tennessee's most thorough.
We want to be absolutely the best at what we do. It's only one way, and that's the right way, and that's the way we do it at Mr. B's Air Duct Cleaning.
At Cigna Health Spring, we have one priority, you. So when you're looking for the right Medicare Advantage plan, we partner with you every step of the way. Cigna Health Spring Plus You means our plans are designed around you with an approach to healthcare led by your doctor. Call Cigna Health Spring now to learn about your options and get a free guide. There's no obligation. Cigna Health Spring puts you first with plans that offer no monthly premiums, no primary doctor copays, prescription drug coverage, even dental and vision services. With a Medicare Advantage plan from Cigna Health Spring, you'll enjoy one more advantage, a focus on preventive care designed to help you stay healthy. Medicare open enrollment is here. Choose a partner that puts you first. Cigna Health Spring. Call 1-855-707-7179. That's 1-855-707-7179. Cigna Health Spring. Together all the way.
She stands in the face of evil and will not lose hope or faith. America, the land of freedom, is still the home of the brave. So raise the banner.
Welcome back to Medical Monday. Tonight I'm Carrie Sharp, joined by Dr. Lucy Ledbetter, a neurologist in Columbia, talking to us tonight about Alzheimer's awareness and also prevention. We're having a very interesting conversation in the break about medicine that anybody could be taking that could be having an impact for the long term.
That's correct. There are several medications that have been found in patients who are normal 70-year-olds that are associated with a higher risk of dementia later on. These are medicines in the anticholinergic family, which means in general, any medicine that can cause your mouth to be dry can increase the risk of dementia and also can affect memory in these people while they're taking the medication. These are medicines such as Benadryl, medicines for allergies, medicines for indigestion, any of the medicines that end where the generic ends in the letter Z-O-L-E, like omeprazole. Those medicines are associated with a 50% increased risk of dementia. Also, antidepressants can increase the risk of dementia. Sleep medications such as Ambien or Lunesta can do it, and also medicines that lower anxiety such as medicines in the Valium family, Xanax, Ativan. All of those were shown in a study to increase the risk by 50% of developing Alzheimer's disease over the next 7 years.
And you're talking about a study that looked at the older generation.
That's correct.
But the big question mark is, these are some of the most prescribed medicines that we have out there right now, and people of all ages are taking them. So
That's
someone
correct.
taking them in their 30s, 40s, and 50s, what's happening to the brain?
Well, we don't know what's happening to the brain. The way these medicines work is they lower the level of acetylcholine. That's the neurotransmitter that is responsible for memory. When we are treating patients with Alzheimer's disease, we give them medicines to increase acetylcholine. So by taking these medicines, you're lowering the same chemicals that we want to increase. What is it doing to a 30-year-old? I don't know. Nobody knows. The research hasn't been done. However, if you don't need these medicines, don't take them, because we just don't know what they might do down the road.
So very important. We're often worried about the side effects that will affect us right now. You know, don't drive. This may cause
That's
sleepiness, but what about those side effects that are going to happen decades down the road? We just don't know.
That's right, Carrie, but I do want to say one thing. Talk to your doctor. Don't just stop your antidepressant or don't just stop these medicines, because the benefits for you may very well outweigh the risks. And we don't know that they're risky for a 30-year-old. We do know without a doubt they're risky for a 70-year-old. But if they're not absolutely necessary, talk to your doctor about maybe getting off of some of these or going to a different choice that's not in the anticholinergic family.
Fantastic point. Let's go to Stephanie now on the line. Hi, Stephanie. What's your question tonight?
Hi. Thank you for taking my call.
Sure.
I had a question. Is it possible to take the acetylcholine if I'm taking Synthroid for hypothyroidism and ferrous sulfate for anemia? Can I take these things within, a 24-hour period on a daily basis? Will they interfere with the Synthroid or the iron supplement, the acetylcholine?
Well, the medication isn't acetylcholine itself. It's a medication that results in your brain making more acetylcholine. Now, always when I prescribe a medicine for a patient, I'll run the two together in my computer and be absolutely sure. I don't know of any reason why you couldn't do that, but I would definitely check with your doctor about it. Not everybody needs to be on these medicines, but if you've had trouble with your memory, it is definitely worth talking to your doctor about perhaps taking a medicine that raises acetylcholine in your brain and potentially helps your memory.
Okay, thank you very much.
Stephanie, thank you for calling. I sure hope that helps. Well, we talk about medication. I always like to look at the more natural side of things. Supplement-wise, what can people do, whether it's prevention or once you've been diagnosed? Anything helpful?
Well, Carrie, that's a really good question. There are some medications that have been shown to be protective as far as decreasing inflammation in the brain or just simply supporting your brain, and one of those is a vitamin B complex. Folic acid may be helpful in preventing Alzheimer's disease or slowing progression of memory loss. Vitamin B12 is one of the vitamins that has been identified that can slow progression of dementia or even prevent dementia in some cases. Also, vitamin D has been discussed as far as a vitamin that can help prevent or slow dementia. Magnesium is another one. Now, there's a whole list of vitamins and supplements that haven't really been proven to prevent or improve dementia, but we don't really know of any risk or any reason not to try them. It's just they've never really been thoroughly tested. One of them we talked about earlier is ginkgo biloba. There's not any proof that it works, but I don't know of any reason not to take it. And there are a whole list of things. One thing that has been tested that has not been shown to really help very much is vitamin E. It makes sense that it would because it's an antioxidant, but it really has not panned out as far as a preventative or a substance that it can slow the onset or the progression of dementia. Now, one other interesting thing is that there have been studies of anti-inflammatories, in other words, like ibuprofen or Aleve, and it doesn't prevent Alzheimer's disease. It doesn't prevent dementia, but it can slow the progression, presumably because it's an anti-inflammatory and decreases levels of inflammation in the brain.
When you have a family in front of you and you deliver the diagnosis of Alzheimer's, I know there are a lot of practical things that you have to go through and medication and really dealing with that. I recently read Kimberly Williams Paisley's book, Where the Light Gets In, and about her mom's journey with Alzheimer's. Yes. And she said, I wish one of the things that the doctors would have told us from the get-go was have that conversation about what your family member wants to happen when things have progressed and they can't vocalize that. Do you speak with your patients about it?
I do. That's very important because you want your patient to be involved in decision making. You know, what do you want to do once you can't live here by yourself anymore? Or what do you want to do if it comes to a point where your family can't take care of you anymore? I do. And who do you want to be your decision maker? Because who do you trust? Those are important questions, and it's tough to have that conversation. It's tough to say, you know, a year from now you may not be able to make these decisions, and I want to know right now what you want, what your opinions are, what do you want me to do. And it's, you know, there can be a lot of tears, and it's a tough conversation to have, but I don't want to know what your family wants. I want to know what you want. And it's a very important conversation to have, and it's important to make some decisions and maybe establish a conservator or a medical power of attorney while you can still have the ability to make informed decisions.
And it can really, later on, decrease a lot of stress for your caregiver and the family, and perhaps prevent some fights and stress in that way.
True. That is true. Because there can be a lot of hard feelings, and sometimes it diffuses things by me saying to the family, I don't want to know what you want, I want to know what they want. And they'll say, well, oh, that's easy, I know what they want, you know, and so sometimes that takes the pressure off the families too.
Another hard decision always comes down to driving and whether someone should be driving. How do you handle that?
That is a tough one, because if you wait to a point where someone's gotten lost or someone's had an accident, you've waited too long. Yeah. But typically, my criteria are if someone has developed sundowning, for instance, so that means confusion that tends to occur in the late afternoon, they don't need to be driving. If they have any trouble as far as orientation, getting lost in familiar places, or even just adapting to new situations, I typically say, okay, it's time for you to get a driver, because those are the kinds of things that tend to lead to accidents. So I want to preempt that. I don't want a person to have an accident before we take the keys away. And
you have to think about, they could harm themselves, they could also harm somebody else, and nobody wants that to happen.
That's right.
Yeah.
So, and usually, even though it's hard, usually patients understand.
All right. On that note, we're going to take a quick break. When we come back, we will wrap things up. If you would like to get a hold of Dr. Ledbetter, we're going to give you all the information on how to do that. So now would be a great time to grab a pen and a paper, and we'll get that information to you when we come back.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
A milky sky with some stubborn cloud cover for most of us across Middle Tennessee and Kentucky during the afternoon hours of Monday. This helped to suppress temperatures somewhat, but all in all, still a pretty nice start to our work week. Some sunshine filtering through in the evening hours will likely set us up for a very pretty sunset tonight, and we expect quiet weather to be the theme, not just into the start of your work week, but through the middle and end of it as well. Above average temperatures will also be the theme. This is what it looks like across the southeast, and of course current conditions right here in Nashville. Overnight tonight we drop down to 62. That is above normal. Normal this time of year is 54. And then Tuesday's highs will remain above normal. We'll hover in the low 80s for most of this work week. 83, the lucky number through Thursday. There is a weak cold front that will work towards us this weekend. The tricky part is it's expected to fall apart. So we'll have some increase in cloud cover and the chance for a stray shower, but not a widespread soaking rain.
Your son wants to get a cat, but you're allergic. Do you A, prepare yourself, B, make the best of it,
C squared equals 25.
Good job.
Or C, find a loophole. When it comes to parenting, there are no perfect answers, but that's okay, because you don't have to be perfect to be a perfect parent. Teens in foster care will love you just the same.
What's so important about your Monday morning?
Your Tuesday night.
Your Wednesday afternoon.
Whether it's your everyday routine or a special occasion.
We understand you've got plans. Don't let the weather spoil them.
Storm 5 weather is as close as your phone, your tablet, or your TV.
We have you covered hour by hour.
Around the clock.
Plan ahead
with the Storm 5 weather team.
Thank you for being with us tonight. Here's the information to contact Dr. Ledbetter. I want to make sure we get this information to you. 615-986-6033 is the easiest way to go about it. Just give them a call and say, I want to go see Dr. Ledbetter, and they will direct you in the right path. You can also send an email to medicalmondays@ouradvancedhealth.com. Last word here on prevention. Everyone knows what Alzheimer's looks like, but how can you prevent it?
The most important things are, if you're diabetic, most diabetes is weight related. The diabetes that comes on in adulthood is typically related to weight. And so weight loss can reverse diabetes, and that can lower your risk of Alzheimer's disease. Correct your blood pressure, that's very, very important, and weight loss can correct blood pressure and cholesterol as well. Those are all medical conditions that raise your risk of dementia. A healthy diet, Mediterranean diet, eat well, eat food that's not processed, fruits, vegetables, whole grains, limit red meat, fish, yogurt, things that are good for you. Those are all important. Keep your brain active, keep an active social life, and all of these things can help keep you healthy and give you a healthy, dementia-free, long life.
I know this is your life's work, but I appreciate you coming in and shedding some light on this for all of us. It is a scary disease, and I'm glad we know more now than we did an hour ago. Dr. Ledbetter, thank you for calling in. Let me give you that number one more time if you need it. 615-986-6033. That's the number to Advanced Health. Just say, I want to talk to Dr. Ledbetter, and they will point you in the right direction. Once again, thank you for being here with us tonight for Medical Monday. Hope you have a fantastic night.